Our patients and our colleagues are why we fight. And why we will continue to fight until our healthcare system truly reflects the values of our profession: compassion, access, a respect for human dignity and rights. We have a long way to go, but I'm committed to this work, and I am ready for this fight.
That's Flint physician Dr. Bobby Mukkamala. He's the 180th president of the American Medical Association. His presidency is historic. He is the first doctor of Indian origin to lead the organization. And during his inaugural address in Chicago Tuesday in front of lots of people from Michigan and friends and family, Dr. Mukkamala laid out his vision of progress, inclusion, and ensuring quality health care for all people. A tough charge that Dr. Mukkamala says he is ready to lead. And the newly installed president of the American Medical Association, Dr. Bobby, as we affectionately call him here, is our guest today here on First at 4 Focus. And Dr. Bobby, thanks so much for joining us today, and congratulations to you.
No, thank you so much. It's wonderful to be at home. It was amazing several days in Chicago with a couple thousand people there, but it's good to be at home.
Yeah. Were you surprised at the number of people from Flint and from the state of Michigan who showed up to be a part of that moment and celebrate you?
Yeah, it was fantastic because, you know, I kind of said to my physician friends that they should be members of the AMA if they want to come celebrate this with me, totally expecting it to be less than the average number of people. It's never sold out before. It was totally filled, and we had to find another 100 places for people to sit. We got to 1,150 people.
That kind of speaks to the impact you're going to have on that organization.
Well, I think that, and also the first Indian. I mean, there are multiple reasons, a lot of Flint, Michigan folks too, but thank you.
I know it's only been a couple of days, Tuesday, and you've had to hit the ground running, but what's been your first order of business as president of the AMA?
Yeah, I think that, you know, we have our priorities, like, you know, decreasing problems like prior authorization and physician burnout. But for me in particular, the last 6 months, I'm dealing with my brain cancer issue has just made me so interested in closing the gap in access to care that we have in this country. You know, my access was phenomenal, right? Went to one of the best places within a few weeks, got my surgery done, and it's been amazing since then. But I can tell you that none of my neighbors, none of the community that's watching us now would have that kind of access. And that gap won't close completely because I'm a doctor and I happen to know people. But just to be able to close that gap even a little bit in this, you know, one round I have as president, which will be over in 363 days now, just to start the momentum to close that gap is going to be wonderful.
Yeah, and it can make a lot of difference. A little bit can make a lot of difference.
Absolutely.
Some of this you laid out in your inaugural address. You know, you talked about the disparities. And what would you say the state of healthcare in America is right now?
Yeah, I would say that we spend more than anybody on the planet. Right. I mean, twice as much as the next country on the list. And yet we are below average in pretty much everything. Right. And, you know, the other thing I notice is when we go down I-75, you see billboards and every hospital is advertising about hernias and hips and knees and procedures. Right. When the disease gets bad enough to cause a problem, that's where all the advertisement happens. I would love to see us prevent disease, right? Taking something like pre-diabetes and not having that ever turn into diabetes because we're on it.
Because you attack it at the onset.
Exactly. That's how it should be. And I think that as a country, we don't invest where we need to invest. And it's, yes, I understand when people have a problem, we should take care of it. But the more we also invest in prevention of those problems, over time, that's a wonderful investment. People are happier, people are healthier, and we don't spend any more, but we're a healthier country. And that's what I want to see happen.
So your presidency is 1 year, you know, 180th president, and it's a year-long presidency. So Dr. Mukkamala, these are some big charges. How do you begin to lay the groundwork, your presidency began to lay the groundwork for some of this transformative change that you've talked about here?
Yeah, I think that happens with conversation. You know, I noticed just in the past 48 hours, there's these Facebook posts. The AMA put one out about congratulations to Dr. Mukkamala for being the 180th president, maybe the 7th one from Michigan since the 1800s, which is all amazing. And most people are complimentary, they're like, congratulations. But I've seen a few posts about there's so much wrong with healthcare and what can he do and things like that. And I think it's communication with people like that that helps us move that down the road.
We're talking to Dr. Bobby Mukkamala, and we're going to continue our conversation with Dr. Bobby. And when we come back, he'll talk about the very serious health challenge that he faced last year. Welcome back. We are continuing our conversation with Dr. Bobby Mukkamala, the recently installed 180th president of the American Medical Association and a Flint physician, making Flint proud for sure.
Thank you.
Dr. Mukkamala, quite the journey between becoming president-elect and this week's installation and becoming the official president. You were faced with a pretty uncertain diagnosis last year. Talk to us about that diagnosis and the surgery that happened on December 13th.
Exactly, yeah, Friday the 13th, which I was a little freaked out about, but it all worked out great.
Here we are again, Friday the 13th.
Exactly, yep. But no, it was an amazing experience to go from just being on death's door with an 8-centimeter tumor right here, which is pretty big, to having a successful operation where 90% of it's removed. That last 10%, there's new treatment available to try to keep that small. Life expectancy is at least 10 years and could be double that. I went from the most miserable day of my life and my family's life to now every day I'm happy, right?
Yeah.
This is what I would consider sort of the bonus days. And I think it's amazing prep to be the president of the American Medical Association. Like somebody up there probably said, you're pretty ready being a doctor for 25 years and taking care of people in Flint, Michigan, but I'm going to push you a little harder. You're going to have this experience that's going to make you a better patient advocate.
Yeah.
And I think if that's what happened, it is totally correct.
And tell us about your recovery. You know, I noticed you came in today with
with
that very familiar look on your
Yeah, I didn't want to take it off because I didn't want to bleed on this beautiful chair.
So tell us, I'm sure that is a part of this recovery that you're undergoing right now. Tell us about your recovery.
Yeah, it's been, I mean, the brain thing biologically has been a challenge, but then just having my mind going through what it's like to be a patient after 25 years in practice, just navigating something, like getting my blood drawn today. Every time I go there for the past 6 months, there's always like a little pause, like, oh, we don't have this in the computer, or can you call this person? And luckily I have access. Like I can call my neurologist, I can call the Mayo Clinic, and immediately they'll send it over. But for a patient that doesn't have that kind of connection to the healthcare system, they're waiting for half an hour, maybe even days. And as a doctor, I would get their labs back eventually, not even realizing the hassle they went through to get this done. And now I know what kind of hassle that is. And it's amazing preparation just to try to improve healthcare. So I'm thankful.
Yeah, and as president of the AMA, are those kinds of experiences that you're now having, you can take back to your colleagues,
Absolutely.
to fellow doctors, you know, who may not have this experience.
Yeah, definitely it informs us as we make policy on what we want to pursue. But it's not that easy, right? I mean, a lot of these things are you know, private business, you know, or even nonprofit entities like insurance companies that sometimes make it a hassle with prior authorization, or government you know, rules and laws about what healthcare they have, or what you get with Medicare, what you get with Medicaid, which is a huge risk right now.
Right.
And so this information helps doctors, I think, make policy that protects our patients and improves healthcare in this country. So it's wonderful to have this as a knowledge point to improve the decisions we make.
Yeah, well, we are wishing you the best in your recovery and
Thank
that
you.
10-year life expectancy. We're claiming 20, 30, 40 years down.
I'm happy with whatever comes, and I love being in this community, so thank you.
The community loves what you do for the community as well. So finally, Dr. Bobby, tell us, you know, what does the future look like this year of the presidency at the AMA and then beyond? What are some of your hopes?
Yeah, so this year is about 200 days a year on the road. So last year as president-elect was about 100, and then this year is about 200 days a year on the road. Yep. So I go to the United Kingdom next weekend to represent us at the British Medical Association meeting. So that'll be a busy year, and then after that, I'm just looking forward to coming back home, not being as busy, and I'm planning on doing ENT work in the morning and then becoming a teacher also, because I think our school system has a lot of challenges, and I'm excited to teach kids.
Boy, some pretty lucky kids they'll be to have Dr. Bobby Mukkamala as their teacher.
Thank you.
Dr. Bobby, you've handled this whole thing with a lot of grace, and you're an inspiration to so many. Thank you for coming in today, making Flint proud.
Thank you.
Your family proud, of course, and also the future of medicine is looking bright.
Thank you very much. It's been a wonderful opportunity.
Thank you for being here.
Absolutely.